Hi, I'm Dr. Ochoa. Thanks for helping with my study. So basically, my study is trying to determine a better way of assessing kids who come in with an asthma exacerbation. Currently, we use something called a PRAM score, which consists of retractions and wheezing and air entry and O2 sat. That obviously needs a practitioner to give, as well as doing a peak flow meter, which you need the peak flow meter and it's complicated and only older children can do this. So what we have decided to do is to see if seeing how long a child can say la 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 in a single breath can help us determine how bad their asthma attack is. So basically for this study, we are trying to recruit patients who come in suffering from an asthma exacerbation. So we're going to get their PRAM score, their peak flow meter reading, as well as their phonospirometry measurement, how many seconds they can sing la 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 in a single breath, both before they get treatments and then after they're done getting treatments in the emergency department. And then we're going to see what the change is in those three measurements. So basically you're going to have to look at this board to determine which patients possibly have an asthma attack. So you're going to look at this visit reason here, and then usually it'll say breathing difficulty or cough or trouble breathing, or sometimes it'll say asthma, but that's how you're going to look to see who can possibly be recruited for this study, so breathing difficulty. And then look here at the age. So the age has to be over 5 and under 18, so ages 5 over 4. So ages 5 to 17 are the age groups that we want. So here is a breathing difficulty, age 11. Here you can look and see what attending and what resident have signed up for the patient. So you can ask them, does this patient have asthma? If there's no one signed up for the patient, then you can go into the room. So look over here, this is the room number. So this patient is in room number 13, and you can look at their name, which is blurred out now, but it won't be blurred out in the emergency department, obviously. So you can go into the room and you can ask the patient if they have a history of asthma. And if they do, then they would be able to be enrolled in this study. So now I'm going to go over how you're going to actually consent a patient to participate in my study. So I'll pretend that I'm one of you guys, and this is what you should say. So just go into the room and introduce yourself and say, I'm working with some of the doctors here in the emergency department to try to figure out a better way to assess kids who come in with asthma. So I understand your child has asthma? And then you say,
Yeah.
Yes. Okay, great. Do they have any other medical problems?
No, just asthma.
Okay, and even if they do have other medical problems, please just write them on the data sheet, and I'll determine if they can be enrolled or not. Okay, so we'll proceed. Your child has asthma. So what we're doing in the emergency department today is trying to figure out a better way to assess kids who come in with an asthma attack. So sometimes we use the pulse ox, that you can see on the monitor. Sometimes we listen to the lungs. Sometimes we blow into something called a peak flow meter. What we're trying to determine is if having your child say la 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 for as long as they can in a single breath will help us determine how bad their asthma attack is. Does this sound like something that you or your child want to participate in?
So it's something that you can do, or you're looking into, as opposed to all these other methods.
Exactly, yeah. We want to see if this is an easier way of assessing how bad the asthma attack is, because presumably the worse asthma attack, the shorter they'll be able to sing.
Okay, yeah, that sounds pretty interesting. Yeah.
Great, so here's some information. So if the child is over 7 years old, you give the ACENT version, and this always goes to the parent, the consent, and they'll be in these blue folders. Okay, so you look like you're older than 7. You can have one of these.
The consent, is it?
So they do not have to sign anything. We don't record any medical information. So that is just for your information to read. Would you like a moment to read?
Yeah.
Okay, I'll be right back then. So everything you'll need for this study is in this nice Doc McStuffins bag. And so this is a peak flow meter, and these are the spare mouthpieces that you do not reuse. There's extra in this bag, so one per patient. Okay, so basically this just goes in here. All right, so the first part I'm just going to have you blow into this. So this is something called a peak flow meter. So basically I'm going to have you take a big breath, put your lips tight, tight, tight around just this part, not this part, but tight around this part, and then blow it as hard and fast as you can in a second. Go. It's not that. It's hard and fast, as hard and fast as you can. The object is to blow this little white arrow as far down this little spot as you can.
All right.
Okay, so I'll let you hold it. Big breath in. Put your lips all the way around it. Hard and fast. Yeah, that's exactly what I was saying. Whoa, that was good. Wow. All right, so you're going to get 3 tries total to beat your score. You got over 600, so you're not suffering from very bad asthma right now. So you're going to get 2 more tries to beat that score. Okay. So normally you do it 2 more times. Okay, so let's say you're done with those 2 times. I give you this for later on. And then I'm going to have you do the phonospirometry measurement. So basically the next thing that I want you to do is take a big breath just like you did. And then you're going to say la, 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 la for as long as you can without taking a breath. So until you're like this, la, la, la. And you have to take a breath. Okay, so try to not take a breath for as long as you can. And I'm going to be timing you here. And again, you're going to get 3 tries to beat your score. Okay, you tell me when you're ready.
So breathe in just like last time.
Just like last time. Big, 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 big breath. And then you start la, la, la. And I'll start timing you and you start singing la, la, la.
All right, let's give it a try.
Okay, ready?
Yeah.
Big breath in. La 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 la. Keep going, keep going, keep going, keep going, keep going. Don't take a breath for as long as you possibly can. Possibly longer, longer, longer. And you keep on encouraging the patient. Encourage, encourage, so that they don't take a breath. And so you can say, oh, you're at 20 seconds already. Keep going. Try not to take a breath. Keep on going. And he has really good lungs. He's already at 30 seconds. So you can kind of keep on encouraging, encouraging, encouraging. Oh my goodness. You're like, wow.
Wait.
So that was 38 seconds. Most of your patients will not go that long because I'd say I'd only had about 3 kids in the normal study that went that long. Okay, so then you say, okay, you're going to get 2 more tries to beat that score. So you're going to get 2 more tries to try to beat 38. We don't have to do that right now, but normally you would give them 2 more tries. Okay, and then the next part of the study is something called a PRAM score. So this the nurse has to give, either the nurse or the respiratory therapist. So inside the Doc McStuffins bag, there is this little cheat sheet that the nurses are going to need to give the patient a PRAM score. And the nurses should be recording a PRAM score before albuterol is given anyway, but they're not always doing that. So you have to try to find the nurse, and the nurse is listed right here on the... So here's where the nurse is listed. So you can find the nurse and have them give them PRAM score. So they have to get a PRAM score at the same time that you did the peak flow and the phonospirometry, and preferably before a treatment. Okay, so here's the data sheet that you'll be recording all of the information on. So basically put your name here and the date. This is pretty self-explanatory, so age, gender. Oh, and then we're going to take a height. So let me show you, I'll show you after I show you the data sheet, our little height thing. So yes, symptomatic of asthma. Just ask them if they used a peak flow meter in the past. Most of them should have, but they don't always, and it'd just be interesting information. So this is preferably measurements before treatment. So hopefully you can get into the room before a treatment is started. If you can't, then it's not a big deal. You just put the measurement after whatever treatment number they were on. And still, I think it's better to recruit them than to not. So if they already got a treatment, don't worry about it, and still try to recruit them because we can still get another set of information. So basically this is self-explanatory too. So this is their PRAM score, which you'll get from the nurse or the respiratory therapist. And then their peak flow measurement, so blowing into the peak flow meter, they get 3 tries separated by slashes. And then their phonospirometry measurement, again, 3 tries separated by slashes. So then after this initial set of measurements, I want you to get another set of measurements after they're done with their treatments. So usually asthma patients get about 3 treatments. So after those 3 treatments, you can get another PRAM score and just say how many treatments they've had. And then here's their peak flow and phonospirometry measurements. So since these are learned techniques, that's the reason they get 3 tries in the beginning. But after they've already learned the technique, they already know how to do a peak flow measurement. You really only need to do 1. So you don't have to do all 3. You can just do 1 measurement if you feel like they had good effort. And I'll leave that up to your discretion. So I just have another one here just in case. Let's say they get 3 treatments, you do this, and then the practitioner decides, oh, I'm going to watch them for a little bit and give them another treatment, you can certainly do another measurement then on them. And I think that'll be really useful information, actually, to have 3 measurements. So just put measurements after treatment number, so then they would have had 4 treatments, and then just do the same thing again and record all your information here. Now, I don't have an area here for other alternate diagnoses. I probably should have written that, but if they get diagnosed with pneumonia, which you'd know by asking the treating physician, just document it here, up here in this corner. Or if they have any other medical problems, just document it here, and I'll look at that data later. It doesn't mean you need to exclude them unless they are premature with chronic lung disease. Those patients probably shouldn't be enrolled, because then it's not just asthma that they're suffering from, it's also chronic lung disease. Okay, that would probably be the only exclusion. Okay, so this is my fancy ruler to measure her height, and it works much better. I used to have just a tape measurer, which you can certainly use as well, but I think it's harder. So I'll show you both ways, so if you don't mind standing up. So this is how I used to measure heights, but as you can see, it's kind of hard when they're taller than you, because you have to go up and then make sure that's at a right angle, and it's just cumbersome. So I prefer not using that measurement. So that's why I just bought this. So this is easy. It just telescopes up. Okay?
Nice.
Yeah. So you can have them stand against it, use a pen against their head, and then mark the spot here. And here you can see, like this is 4 feet 1 inch, 4 feet 8 inches. This is 5 feet. So he's 5 feet 7 inches. So we'll make this a little bit clearer, because I want the recordings to be only in inches, not like 5 feet 7 inches. So we'll just, mark 60 here. So it's easier for you to know that it's 67 inches. Okay? Is that clear? This is a little heavy and cumbersome, but I think it's useful. Okay?